So it would totally make sense to be scared, nervous, terrified to take an HIV test because it could come back positive and you could be facing a lifelong diagnosis where you have to take medications and you have to tell people you have HIV. HIV is a disease that requires you to share bodily fluids. And so that's in things like sharing needles with IV drug use or sharing blood, like a blood transfusion, or the most common way is through vaginal fluids or semen with sexual intercourse. So there are certain groups that are higher risk for HIV. The teaching is that men who have sex with men, individuals that identify as transgender, IV drug users, also individuals in certain populations like in the incarcerated population or unsheltered individuals may end up having higher rates. So the CDC recommends that everyone, as part of their routine care that's between the ages of 13 to 64, is tested for HIV. That often happens at least once a year. And the reason why that's so important to do is that your exposure to HIV is through different means like sex, IV drug use, things that may happen in some years or at certain times and not others. If you're someone who's high risk, you may actually want to get tested more frequently, like every 3 months. The other individuals that we will routinely test for HIV is anyone who's newly pregnant. And that's because individuals that are pregnant, if they have HIV and it isn't diagnosed and treated, could transmit it to the infant. The other thing to consider is that if you have HIV and you're kind of like, I don't want to know, I never want to know, you're also spreading HIV to other individuals. So there's both a kind of personal benefit and there's also a public health benefit if you're tested as well. So getting tested for HIV is something that could really empower you to take care of your health, because once you have that information, you can make the decisions that you want to make sure that you're protected going forward. So really, in this case, knowledge really is power.